Not the 50% increase that will happen if we don't do this, and then, oh, by the way, we'll take credit for reducing it another 20%. So raise it 50 and reduce it 20. If that's your plan, God help you and God help your constituents. Because that's not what they sent you here to do. And all of those promises that you made on the campaign trail will be broken. So the decisions we make here are not always easy. They are tough. But your constituents didn't send you here to ignore tough decisions and to sit on your hands. They sent you here to take action. And this is your opportunity to take action. Thank you, Chair Davids. And I'd ask for a green vote.
The member from Blue Earth, Representative Munson.
Thank you, Madam Speaker and members. I felt the need to rise today because we were discussing the bipartisan vote in HHS Finance yesterday against hearing this amendment in committee. And I was the Republican that voted against it. I was talking to Representative Hamilton, who voted against the reinsurance bill when this originally came to the floor. And I do want to say something about what Representative Daudt had said. This reinsurance program was successful in lowering the cost of insurance by 20%. He's absolutely right. Maybe it was an average, but it worked. But it's not a shock when you spend hundreds of millions of dollars to the insurance company with the intention of paying down rates. If you say you want to pay 20% of my dinner bill, and when I get the bill, it's 20% less, that's great, it worked. That's not a success. Paying down the insurance rates with taxpayer dollars, and by the way, these are taxpayer dollars taken from all taxpayers. And these are the private insurance rates, which used to be for 11% of Minnesotans, but people like me in rural Minnesota who had one insurance provider in my area and who raised the rates for my family of four to $26,000 a year in premiums with a $13,300 deductible, almost identical to what Representative Daudt was saying. That was my insurance. And my family opted to go without insurance because that was the bronze plan. The gold plan was $42,000 a year in premiums. This is not sustainable. This is not, you can't tell me these rates are attractive. And even with this reinsurance rate, a 20% buy down on that rate still wasn't attractive for a healthy family to buy. We need better solutions. Now, Representative Daudt's claim that your program is going to raise the rates is absolutely right. It will raise the rates. But the difference is, instead of buying it down on the back end with the insurance company, your plan is to give everybody a 20% off coupon. And in your defense, your program's actually fair because then everyone gets a 20% off coupon. Doesn't mean the insurance companies can't raise the rates in that area a little more, but yours would be a little more fair to people. This plan would be dumping money into the insurance program with less transparency and less accountability. And in both of these programs, we open it wide open to fraud. Now, what I want to say is that the job of the insurance company is to offset risk. That's why we have insurance. Otherwise, we just go and pay our own way. But once in a while, people get caught up in bills that they can't afford to pay, so you buy insurance to cover that catastrophic issue. The reinsurance program takes an enormous amount of risk away from the insurance companies by saying once the person like me paid $13,300 out of my pocket, and then the insurance company covers it between $13,300 to $50,000, then all of the taxpayers pay everything from $50,000 to $250,000. If you're taking away the insurance company's need to offset all this risk, then what is the insurance company doing? They're not doing their jobs. And if you want to talk about socialism and programs that move us towards socialism, let's talk about privatizing the profits of insurance companies, but then socializing the losses. Okay, taking the government and making the government absorb all the losses for insurance companies, that's socialism. And that's destroying the private market. That's where we take the job of insurance companies and we move it into the government. That is a clear way of destroying this private insurance program. And that's what's frustrating to me. I didn't campaign on reinsurance, and I didn't campaign on giving people coupons. I campaigned on free markets and healthcare, because free markets have been proven for thousands of years to drive down prices based on supply and demand. And when people are mad because their rates go up, they sharpen their pitchforks. Or they, like me, they drop insurance. When you take away someone's mandate that they have to buy insurance and they drop it, and the insurance used to be 11% of the private market in Minnesota, but people like me got fed up with paying these outrageous rates, we left. And now insurance companies realize their rates were too high. And if we had free markets in healthcare, they would lower their costs to bring us back. But the reinsurance program just dumped a bunch of money in the back door, and you guys want to give everybody coupons paid at the expense of all taxpayers. That's wrong too. We need price transparency in healthcare. We need to allow people to shop outside of their insurance networks where they dictate they go. That's why I am the chief author of the Patient Right to Shop Act, which would bring drastic free markets to healthcare and allow people who are the sickest among us, who have the highest costs of healthcare, to actually shop around and save money. The insurance company has to give them 50% of the savings. The other 50% goes to the insurance pool to lower the cost for everyone. My bill's held up in committee just like this one. The committee chair sitting on mine used to work for the insurance industry. I was kind of excited about getting a hearing knowing that the Democrats are in charge. But I'm not going to get a hearing either. This is frustrating. And I'm just asking for the right to shop for care. I want price transparency because I know free markets are proven and they drive down the cost of care. Look at LASIK eye surgery. It isn't covered by insurance and people have to pay cash. It used to cost thousands and thousands of dollars, and now it's like $2.99 an eye, buy one, get one free. People have to advertise, people are allowed to shop, people are rewarded financially for shopping. This system works. So I don't believe in reinsurance, and I don't believe in giving everyone a coupon that's paid for a small select group of people that's paid for by all taxpayers. I sat in committee yesterday, and Commissioner Kelly said, I haven't met somebody who doesn't support either one of these programs, so I had to go introduce myself. I support free markets. I door knocked in my district saying, I got a healthcare price transparency bill through that the governor signed that sticks it to the insurance companies and sticks it to the pharmaceutical companies because this will bring more price transparency by displaying some prices. And they loved that. They love empowering patients because when you empower patients to shop, then the insurance companies can't buy their way into legislation on either side of the aisle. I'm a Republican. I don't caucus with most of these people because I like different ideas. But this idea of telling you your plan is increasing rates is bogus. Of course, it's going to show higher on the bill, but you get a coupon, you end up in the same exact place. And I don't like people fighting over free dollars. I heard that in committee yesterday. Well, we're trying to maximize the amount of federal dollars for the program. This is our money. This is taxpayer money. It doesn't matter where it comes. And the more money that goes through the government and comes back, the more we increase socialism. Make insurance companies do their job, offset risk. Don't shove it onto the government. Let's expand the private market. Let's have free markets. Let's have a right to shop. This is the way that we lower healthcare costs. And free markets is proven to work. This is one of the last sectors of our economy that we don't have price transparency, and that the less pricing we have out there, the insurance companies will make more money off of it, the pharmaceutical companies will make more money off of it. Let's empower people to make their own decisions, because we have people with high deductibles in my district that are afraid to go to the doctor because they don't know what things cost. So you have insurance, and I hear a lot of people talk about lowering healthcare costs. Everything that was discussed before I stood up wasn't about healthcare costs. It was about health insurance costs. Health insurance is not health care. We are doing nothing about lowering the cost of health care unless we actually talk about price transparency and letting people shop. This is just shoving money around through government and growing government and socializing the system. And I'm saddened to hear this.